Hey there, Dr. Neil Levin here, and today I want to tell you about the chiropractic subluxation. So, what is a subluxation and why do chiropractors treat them? Well, a subluxation is when a joint, maybe a vertebrae, could even be one of your other joints, isn't moving correctly anymore. It's gotten stuck. And when joints get stuck and don't move properly through their normal range of motion, the body does not like that one bit. In fact, relatively quickly, within hours, it can actually start to lay down fibrous adhesions, which is a type of scar tissue that makes the joint fuse even more. Right? Nerves hate a lack of motion. They want the joints to move through their full range of motion, firing off our mechanoreceptors, firing off our proprioceptors, so our body knows where it is in space. And so the nerves get irritated. When nerves are irritated, what do? Well, they cause the muscles to splint, to guard, and the joint gets even tighter. When the joint doesn't move properly, it creates inflammation. Inflammation further irritates the nerve, and you can see how this process just winds up, and we end up with these stuck joints. Now, oftentimes they'll resolve on their own, and that's great. And when we're 18 and even 28, that happens quite a bit. By the time we're 38, 48, and getting older, these joints get stuck and they often want to stay stuck. Now, if they're stuck for too long, it'll create a compensation pattern. And now all of a sudden you're not moving properly, creating all kinds of muscle imbalances. Furthermore, if the brain isn't getting the appropriate neurology because the joint isn't moving, the parts of the brain and the post-central gyrus up here that sense movement and where your body is in space actually start to degenerate as well. And last we want is our brain to degenerate in those areas. All right, so what do we do? Well, chiropractors are experts at detecting these subluxations through palpation, through there's 200 different types of chiropractic analysis. Personally, what I like to do is check for motion. I check range of motion, but also intersegmentally, like so between different vertebrae. So maybe I'm checking the thoracic spine, and between T4 and T5 or between T7 and T8, I want to check for the motion because we can have, say, relatively normal motion in the thoracic spine, but yet two vertebrae might be stuck. And so we're still getting motion, but these two vertebrae are stuck. And if it's around T6, they may be vertebrae that's going to the digestive system. That's why sometimes people that come in here with a digestive issue get some adjustments and they feel better. So we're not treating with the adjustment their digestive issue. We're treating the spine, but because the nerves go to their digestive system, they can get benefit. So again, chiropractors are experts at detecting vertebral subluxations and then providing the appropriate force, a thrust, an adjustment, a manipulation to free up the subluxations so that the body can function normally. When you free up the subluxation, you're literally changing the nervous system. You're taking that stuck joint with the irritated nerve, you're normalizing motion and function in the joint, and now the nerve isn't irritated anymore and it functions normally. Now the muscle guarding can let go. The inflammation can return to normal. So that's why chiropractic is so fantastic. Now, what about dose? Well, there's studies out there, but maybe the best study was by Haas back in 2014, which basically says that 50% of the people will be 50% better after 12 office visits. Now, if you're a fast responder, certainly, I mean, oftentimes I'll adjust kids, in their teens and their early 20s and 1 or 2 visits, and they are off to the races. But the point is, if you're in your 40s, 50s, 60s, it's likely if this subluxation is kind of chronic, if it's been there for a while, and if I tell you it's been there for a while based on my exam findings, it has been, it's going to take several visits to normalize it. Now, you may literally be out of pain in, say, 6 or 7 visits, but maybe not. But the point is, it's not likely that the subluxation is completely corrected yet. All right, we need to literally take a joint that's stuck. So here's a vertebrae, a disc, and a vertebrae, and it's supposed to move through a full range of motion. And let's say it doesn't move to the left and you're in your 50s. All right. Now, I may do some adjustments and I'm going to adjust it into that normal range of motion, but you're going to get out of pain faster than the motion is completely normal. So the point is, if it's supposed to do this and it's only doing this, yeah, you might be out of pain. But if it's not going all the way, we want to clear that out so that it's back to normal. Okay, so now how many visits will it take? We don't know. But if you're a fast responder, it might be less than 12. If you're a slow responder, it could be 24, it could be 30 before the subluxation is completely resolved. Now, why is it important to fix this motor unit, this vertebral motor unit with the discs and the nerves? What would happen if we didn't fix it? Well, this is what your vertebrae and discs and vertebrae and nerve and the hole where the nerve comes out looked like when you were younger. But as we get older, that disc can degenerate so that it's a little thinner and the hole can get a little smaller. And as we get a little older still, if there's joint dysfunction, this motor unit, this disc is much thinner. Compare this to a more youthful joint, right? That disc is not as happy. And also, the hole, the space for this nerve is much bigger. That nerve has a lot more room than this one. So this hole, I don't know if you can see it as well, is smaller. Trust me, if you can't see it on the video, it's just there's not as much room for that nerve there. And if it goes even further, like this person's like really in trouble. So the point I'm making is chiropractors detect and correct vertebral subluxations, normalizing motion and function in the spine, which is very important for neurology. It's normalizing neurology. Your brain, your autonomic nervous system controls everything. Your breathing, your heart rate, your metabolism, everything. And vertebral subluxations will have a negative impact on your overall health. So we want to correct them and then we want to maintain them. Yeah, if I get an 18-year-old in here, maybe I give them a couple of adjustments. Maybe they don't need to see me for 10 years. I don't know. But anybody over the age of 40, you're getting to the point in your life where joints want to get stuck. It just happens. It's part of the aging process. And coming to see me or your chiropractor at least once a month, personally at 62, I like to do every other week, is very important because we want to correct these subluxations early before they become fibrous, before they get too much scar tissue and really get stuck. Because if we get them early, 1 or 2 visits and you're back in business. All right, there's a whole nother point we need to make here in terms of nutrition and inflammation, and we'll get into that in another video. But for the pure chiropractic of it, this was the meat and potatoes. This is the reason to get adjusted and then stay adjusted and maintain your spine with healthy function and motion. So I hope you enjoyed this. I hope you learned something. I look forward to seeing you in the office. Bye-bye.